Right, and welcome back to Weekend with Betty. Of course, you've been following what has been happening on the show. That story that Anthony Gadvi actually covered, actually did for 6 months, filmed for 6 months, the whole production. And of course, just to get to know that later, that story was not true and it was a lie. So that is why this feature particularly was called The Cancer Lie. And like I mentioned, we have people who will help us really to sort of like unravel, just why, something like that would actually happen. And in studio we have Dr. Esther Mbao, who's a consulting psychologist. Thank you, Esther, for joining us. I was seeing your reaction as the story was going on. And of course, also we have Dr. Catherine Mutisia. Thank you so much for joining us. She is a psychiatrist. Thank you so much. Appreciating your time tonight. So maybe first of all, Dr. Esther, I'll start with you. First reaction to that story, The Cancer Lie, the feature.
Thank you, Betty, for having us on the show. I would start off by saying first, every behavior is need-driven. So this behavior, there was a specific need that it was meeting. So I wouldn't be so quick to judge her, but I would actually take time to understand and try and put myself in her shoes to see where she's coming from.
Right.
Earlier on, she had said she's coming from a family of cancer patients,
Yes. Yes.
Given that maybe that's what has been happening,
Right.
those are the people who've been getting attention.
Yeah.
And every one of us wants attention from our families. That could have been her cry. So every behavior is need-driven. Let's not be quick to judge her. Let's try and understand and even evaluate ourselves.
Right.
Because hers was the cancer lie. But we
But
all lie every day.
we all lie.
When you go to social media,
Right.
we all lie.
All right.
When someone calls you, you come up with a
You
lie.
say, I'm in traffic, you've not left the house.
Thank you.
All right, Dr. Catherine, maybe I can hear your thoughts, your reaction to this particular feature.
Yeah, let me first put a disclaimer that I've not yet assessed her, and so my answers will be generalized.
Okay.
And I looked at it, and having heard Anjali's story that she's actually going through treatment versus this other story which ends up not being right, everybody would wonder why it would somebody would go through that. But like Esther said,
Right.
there must be a need which is unmet. I thought about probably a personality disorder, probably childhood trauma, which hasn't yet been resolved. And as we discover many more mental health needs, we need to all be able to reach out, and those who need psychotherapy, those who need further assessment,
Right.
to access it.
All right.
Yes.
So you're coming from a very professional point of view, and you've rightfully said you haven't assessed her, since the story aired or even during that time. But Dr. Esther, let me ask, is there a small lie and a big lie? Is there like, because when you lie about something like cancer, something that actually has led to so many deaths, affecting so many people. It's not something it's not like, saying I'm in traffic and I'm not. Would you consider that there are small lies and there are big lies, and there's different ways to react to this too?
Okay, let me first start off by saying I'm not Dr. Esther. I'm Esther. So
Okay, all right, okay.
just to be clear.
Okay, Esther. Okay, all right.
But let me say that lies start from somewhere. You try something small, it works. So what happens? You continue building up on it.
Right.
What normally happens with our children is they test the waters with lies. And when they discover that you actually caught in the web, they keep lying.
Right.
The same thing with us adults. The first time you go to lie, you rationalize it. First, you have an issue like, do I do it? Do I not do it? And then when you get the achieved results of why you wanted to do the lie, it actually gives you motivation to keep lying. So what happens? You form a habit, because from our actions, when you keep repeating that, it becomes a habit, and we're creatures of habit. So what happens is our brains are wired to actually living not in reality, but within lies. So it becomes a natural way of life for you. And so with
And
time,
dealing with things.
yes, and with time, as it keeps meeting your needs, like with every other addiction, you need more and more doses. So what happens is you move from the small lies and you transfer them to the bigger lies,
Right.
because you need a bigger dose, a bigger high, a bigger challenge for you to get that high that you're feeling initially.
And it's interesting that she mentioned the word high, because in the confession, actually, she says it's like a high.
Yes.
Dr. Mutisa, let me come to you. Talking about treatment, like you said, there's an issue behind, why we all lie, why, she lied about this. what kind of treatment, how do you know that, maybe you're a compulsive liar? Is there a way to like sort of like self-reflect or self-analyze? And is there a way out?
Okay. First of all, treatment would be correct if the diagnosis is correct in the first place. And so the first step would be to make the right diagnosis. Are we dealing with a personality disorder? Are we dealing with unresolved trauma issues? Or exactly what are we dealing with? Is it malingering to have a gain? Because we've had cases where people would lie they have cancer and fundraise and get a lot of money.
Right.
Or are we dealing with a psychiatric disorder? Are we dealing with psychological disturbance? So we need to do the correct diagnosis, then we institute the right treatment.
Right.
I've listened to the story and it was very dramatic, the way the story was told. You had a few minutes with Anjali and it got emotional.
Yeah.
But when the story was being told, there wasn't much emotion.
Yes.
Even when she described how she went through chemotherapy,
Yes,
radiotherapy,
yes.
it didn't look real. It sounded very dramatic, and that's why I would be thinking of histrionic personality, where people would dramatize and get attention. But again, I'll keep saying that we need to evaluate her. My answers, I've not assessed her, so I wouldn't say that is what she's dealing with.
All right, let's expand the conversation as we wind up, to all of us. Like, Esther, like what you said, like, fine, she lied, but we all lie. And you mentioned something very interesting, especially with this day and age, social media. People, post things, or, things that they own, that they don't own, or the kind of life that they portray on social media is not the real, the way things are on the ground. But why do we lie that much? Why is it that way? And is there a way to sort of like correct ourselves, just generally and broadly speaking, about just society as it is right now?
Generally, I would say we lie because first, we're not in touch with reality, or we just don't want to accept the reality as it is. First thing that would come to mind would be to assess her and look at where is she in terms of her self-esteem. Have you first accepted yourself before others can accept you? If you don't accept yourself, then you don't take yourself out there.
Right.
What you do is you put on a different mask and you say, this is the version that other people will come to know of me. But what happens is your mental system is not at ease because that is not who you really are. So it's not at ease for a while and it creates a disease. So that's when mental health becomes an issue in your life. It could also be about coping with life issues. Sometimes things happen to us, and because our systems cannot accept them immediately, we get into a place of denial, and then we get into the denial phase and now cope with life through denial. So we never go back to reality. But stay in the fallacy. So we need to really understand someone's case by case, their environment, their personality types, their nurture and nature factors. There are a lot of factors to consider.
All right.
But what I would say in closing, I would want to affirm her that she's been very courageous to come out finally and say, you know what? This is the real issue.
Right.
I wouldn't be quick to label her because even when she said she's a compulsive liar, who gave her that title? Like Daktari has said, no one has assessed her, or she didn't say who and so assessed her. So also labeling. There's the mirror effect where we take on labels that other people have given us. She took on the label of cancer because it was in her family. So we need to really understand certain factors that could make us end up being liars.
All right.
Yes.
As we finish, Daktari, I'm sure she was watching, and other people who maybe done the same thing, were also watching. How then do you? Because there's going to be maybe a lot of flack, some negativity, on her. Like how would you deal with the side effects, if just so to speak, of doing such a thing?
Definitely, if it goes to social media, there'll be outbursts. Many of them will be negative. But again, each of us needs to get to the point where you feel you can cope with any situation with help. So even as the story gets out, I hope she would be able to reach out to us and we can be able to assist for her to be able to cope with that trauma. And I'll repeat that she needs to believe that she's good enough, she's worthy of love, and she doesn't have to be somebody else for her to be loved. And she can cope with any situation in life. And it would be very good for her to be assessed so that we can see how to help her.
All right.
Yes.
Well, thank you so much. Thank you so much, ladies, for your contribution tonight. I've been speaking to Dr. Catherine Mutisia, who's a psychiatrist, and Esther Mbao, who is a consulting psychologist. Thank you so much. All right, so we'll take a short commercial break. I'll also be looking at your comments about the particular feature we were talking about, the cancer life. So don't go away, we'll be right back.